in developing an action plan, it's important to consider audit preparation. And the Office for Civil Rights, we'll just refer to them as OCR, they say that it makes sense to audit healthcare organizations of all shapes and sizes. And it makes sense. You know, after all, one of the goals of the audit program, it's to spur across the board compliance, okay, with HIPAA, with security and breach notification rules. And the best way to do it is to scrutinize a variety of providers. And virtually any organization that's audited is going to have some HIPAA compliance issues that it has yet to resolve. And so OCR, they urge covered entities to document in advance. Just document any of the areas where you know today you need to work on them. This will give you some flexibility. If you document the areas you know you need to work on and the steps you plan to take, you'll be amazed in the flexibility that provides when you have a discussion with her, should you have a discussion with an auditor. Some of the areas that OCR audit include the following. The first is risk analysis. We've covered that today. The second is evidence of a risk management plan, list of known risks and how they're being dealt with. Next, policies and procedures and descriptions as to how they were implemented. Inventories of business associate agreements and the relevant, and an accounting of where electronic protected health information is stored, how mobile devices and mobile media are secured and tracked, documentation on breach reporting policies and incident responses to policies and procedures, a record of compliance training that has been completed, and evidence of capabilities. Okay, risk management and compliance training are two big ones that you should circle in your notes. So 5 common circumstances for receiving an audit. Here they are. The first is a disgruntled ex-employee turns you in. They're wanting to get back at their employer. We had a situation where one of the physicians that we've stayed close with for years indicated that one of his employees was very disgruntled when she was fired, and she knew that the doctor hadn't documented as thoroughly, and so she filed a complaint that she had to work all these extra hours and the doctor couldn't show that. And the short of the story is the doctor had to pay her, was fined. It ultimately caused so much this one thing became such a big wedge that he decided to close his doors. So disgruntled ex-employee is huge, and this anyway. Number 2, excuse me, a self-reported breach. And as I've mentioned before, this is actually required by HHS. You're required by law to report your breaches. Employee activists may anonymously contact the OCR, and there's a hotline number for that. Patients' belief that their information has been breached, or they believe someone else's information is in jeopardy. And then the 5th is just a random OCR visit. And we talked a little bit about why that is the case. A couple more things, and we're just about closing up. The U.S. Department of Health and Human Services, they've put together a collection of tips and information to help you protect your health information that you may access, receive, and store in any mobile devices. And that's including smartphones, laptops, or tablets. And so a couple of resources for you. And this presentation, if you want to click on the hyperlinks, if you've already downloaded this on SlideShare, fantastic. You can also find a link below this video afterward with a couple other links that can be resourceful for you. So, quick story. In order to do this, mitigate risk. Learn from this story. Recently, a student healthcare worker, Karen, was fired from the University of Iowa Health Center. What did she do? Well, she violated the privacy of a pregnant female student and her well-known student-athlete boyfriend. Now, for over 14 years, Catherine, she had HIPAA privacy training. She knew better. But that didn't stop her from revealing out loud to at least one that we know of, a co-worker, that she just mentioned that she hoped that the young couple was happy with the positive results of a pregnancy test. Thing is, Catherine even went so far as to point out the student athlete to the clerk after she noticed him in the waiting room. She also inappropriately accessed the patient's chart at least twice, opening the records from past visits and medication records. So, the results. Well, the clerk went and spoke with two medical assistants who treated the female student and asked about the couple's reaction to the news of the positive pregnancy test. Well, they had had training as well, and the medical assistants then reported the inquiry to a manager as a possible privacy violation. So, yes, there was a culture of privacy, and my goodness, that could have cost a big fine instead of just firing. It could have cost the Iowa Health Center thousands. And so creating this culture is just so important, and we recommend deliberately creating a culture that emphasizes PHI confidentiality. And you can do this in a number of ways. I'm going to mention 5 in closing. The first is speaking often about the importance of trust in the patient-provider relationship. Okay, just remind the workforce that patients expect your practice to be a good steward of their healthcare information. Continually reminding staff to safeguard confidentiality and the security of ePHI. Number 3, make sure your staff has a copy of your policies and procedures for easy reference, and remind them to comply with those policies and procedures. The last 2, addressing staff questions and getting outside resources to help you if you feel you need additional expertise with compliance and message delivery. And the last one is reassessing each workforce member's job functions and enabling or disabling the amount of access they have with patient healthcare information.